Good morning and welcome to today's web seminar. This is Simone Turek-Lee. I'm with John Burton Advocates for Youth, and we're going to give people just a few seconds to join, and then we'll get officially started. All right, good morning again. Welcome to today's web seminar, 6 Immediate Steps Counties Can Take to Protect Youth in THP-PLUS During the COVID-19 Crisis. This is Simone Turek-Lee. I'm with John Burton Advocates for Youth. And kind of before we dive into the content of the web seminar, I want to just go over a few kind of housekeeping items to make sure that everyone's in and joined and can hear us and see the screen. So there are, if you're seeing this slide and you're hearing my voice, you're good. But if you encounter any audio issues during the web seminar, you can, we recommend, trying to use the opposite audio option you're currently using to see if that works better. So particularly if you're listening through your computer speakers and are having trouble hearing, try selecting the call-in option and using the phone number and code on the screen. That information will be available in your control panel throughout the webinar. So once we turn from this slide, you can unclap your audio section to access it at a later time. At any point through the webinar, please submit questions to us. We will have a question and answer session at the end of the webinar. So, feel free just at any point to send those questions along and we'll address them at the end. And then lastly, we always, we're recording today's webinar, and that recording and these slides are always available on our website, but we will also send them out to everyone who registered for the webinar later today. And then I also posted a PDF of the slides and also of the report that will be, or the, not report, but the guide that we'll be discussing in the control panel under handouts. So you can access those now if you'd like. So I'd like to just go over kind of our agenda for the day, and then we will dive in. So we'll start with welcoming, I'll welcome our partners on this webinar that I'm presenting with today. Then we'll provide an overview of the Transitional Housing Program Plus. We'll hear an overview of the THP-PLUS program in Santa Clara County. And Santa Clara County we'll be hearing kind of throughout the webinar how Santa Clara County utilizes some of the strategies that we'll be sharing. So we'll hear from them throughout the webinar. We'll discuss the impact of COVID-19 on transition age foster youth. Then we'll go over the 6 strategies that counties can utilize kind of either to extend or expand their THP-PLUS programs or to access other housing and supports for former foster and probation youth. And we'll be, I mentioned we'll be hearing throughout from Santa Clara, and we'll also hear some additional strategies that they've been utilizing on top of those 6. And then lastly, we'll hold a question and answer session. So again, do not forget to submit your questions through the control panel. So I'm joined today by some wonderful presenters. We're joined by Sabrina Forte. Sabrina is a staff attorney at Youth Law Center. Youth Law Center is a national advocacy organization located in San Francisco. And then Britt Harwood is a senior attorney at Bay Area Legal Aid. Bay Legal is located in Oakland, but provides legal assistance across a 7-county service area. And Carla Macias is a social work supervisor in the Independent Living Program, Education, and THP-PLUS for Santa Clara County Social Services Agency. And I'm Simone Turek-Lee, and I'm the Director of Housing and Health for John Burton Advocates for Youth. And we're located in San Francisco, but also do statewide legislative advocacy and technical assistance work. So now I'm going to pass it over to Sabrina to provide an overview of THP-PLUS.
Good morning, everyone. It's good to see so many people joining us today. I'm going to kick off with a brief overview of the THP-PLUS program. Next slide. So just to give a quick crash course in THP-PLUS program history, THP-PLUS was established in 2001 by Assembly Bill 427 in response to the high rates of homelessness among former foster youth. So that means that it predated extended foster care and the other supports for transition age youth that we're really familiar with by about a decade. It was initially available to young people between the ages of 18 and 21, but was extended to serve a broader age group in 2005. The funding structure for THP-PLUS has fluctuated from a program with a county share of costs to a fully state-funded program, and finally, in 2011, to a county-funded program when Governor Brown realigned child welfare services to the counties. The THP-PLUS budget was then, and is now, $34.9 million. And county funds are based on what they spent on the program in the year prior to alignment. So there's sometimes some asymmetry between the need for THP-PLUS resources and the amount allocated to the counties. Next slide, please. The THP-PLUS program elements are twofold. It's a coupling of affordable housing and supportive services. Housing models can vary and can include apartments, single-family dwellings, host family models, and others, but they are subsidized and leased by a nonprofit provider. And then supportive services range from counseling and case management, to educational support, to independent living skills, and of course, assistance transitioning to affordable housing upon exit. These are set forth in the THP-PLUS TILP that all participants prepare with their THP-PLUS program or with the county as a condition of their eligibility for THP-PLUS and as a guide for the youth and their program to work toward the goals and identify needed services to reach those goals. The overarching goal, of course, is for THP-PLUS to provide a safe and adequate residence and allow participants a maximum amount of independence and self-sufficiency. Next slide, please. So the THP-PLUS eligibility criteria are, I'll group them into three categories: age and duration, foster care case status, and then the TILP. The age and duration requirements vary by county depending on whether the county is one that is opted into the THP-PLUS extension, which we'll talk about in more detail later in this presentation. But at a minimum, the age range for THP-PLUS is at least 18 years of age and not more than 24 years of age. And the youth must not have participated in THP-PLUS for a cumulative 24 months to remain eligible for THP-PLUS. If a county opts into the extension, then a youth who accesses THP-PLUS in that county must be at least 18 years of age, not more than 25 years of age, and must have participated in THP-PLUS for less than 36 cumulative months. And because the age range and the duration limits don't completely apply, it's whatever comes first. So in a county that's opted into the extension, a youth who participates is eligible until they turn 25 or have participated for up to 36 months, whichever comes first. The second criterion that I'll talk about is the foster care case status criterion. The youth must have exited out of home care, either through the child welfare system or through the juvenile probation system, on or after their 18th birthday. So their foster care case should be closed. They should have exited foster care, which is different from other transitional housing programs, which are placements for young people who are currently in care. And then lastly, THP-PLUS participants must be working toward the goals of their TILP, which their provider and the county should be working collaboratively to put together and revise based on the youth's strengths, needs, and short and long-term goals. Next slide. This is a snapshot of youth participants in THP-PLUS. Over fiscal year 2018 to 2019, 1,739 youth participated in the THP-PLUS program. The moment in time housing capacity was 1,252 participants, and THP-PLUS exists all over the state. There are 55 provider organizations operating 77 THP-PLUS programs across 47 counties across the state. So it's pretty vast. Next slide. Unfortunately, there is tremendous demand for THP-PLUS, which results in hundreds of former foster youth on THP-PLUS waitlists. There are 636 youth on waiting lists for THP-PLUS statewide as of June 30th, 2019, which was a 53% increase from the year prior. We are inferring, and Britt will talk about this data a little bit more, but we are inferring that the wait lists have likely grown during COVID-19 and some of the housing stability that has occurred as a result of COVID-19. And 35% of youth experienced homelessness between foster care and THP-PLUS. So we know that many of the youth on waitlists are entering from an experience of homelessness or housing stability. And we know that THP-PLUS can be life-changing because only 6% of THP-PLUS participants exit to homelessness or unstable situations. We always want that number to be 0, but the data do show that this housing and supportive services intervention can help stabilize housing for former foster youth in the long term. Next slide. To illustrate this point further, here is some data on other outcomes underscoring that THP-PLUS is a critical support during significant moments in a young adult's life. So in the fiscal year 2018-2019, 88% of participants had completed high school at exit. 26% of youth were attending post-secondary education or had earned a degree, certificate, or license at exit. 60% of youth were employed at exit, and 40% of young women were custodial mothers at exit. Next slide. So I know I would be preaching to the choir if I spent too much time emphasizing the importance of housing stability for former foster youth, but in light of current events, I will add that on top of all of its other stabilizing benefits, what we know now more than ever is that housing, especially housing that is coupled with services like THP-PLUS, is a public health imperative to prevent the community spread of COVID-19. Staying home, one home for the duration of the crisis, is a critical public health strategy. And our THP-PLUS programs align with public health guidance to stay indoors, with state and local policies preventing the loss of housing in the vast majority of circumstances, and with the expansion of safety net supports and public funds to maintain income and avoid homelessness. So the principles underlying state and local policy need to apply with equal or greater force for our THP-PLUS participants, our former foster youth, and that's the impetus for today's webinar. So with that, Britt is going to share some more information about how COVID has already begun to impact youth in transitional housing programs. Next slide.
Thanks, Sabrina. As Sabrina said, before we start talking about strategies for maintaining THP-PLUS youth in their housing, we wanted to paint a picture of the way that COVID-19 is currently impacting former foster youth. This landscape is important for understanding just how destabilizing the loss of housing would be for young people who are already going through extraordinary disruption because of the effects of COVID-19 and because of shelter-in-place orders. So I'm going to review key findings from a survey that was done by John Burton Advocates for Youth in April. The survey went out to 60 licensed THP non-minor dependent providers to understand the impact of COVID-19 on the education, housing, health, safety, and employment of youth in their programs. 57% of programs responded, so the survey covered 1,728 youth. Even though the survey addressed a slightly younger age demographic, since THP non-minor dependent is mostly 18 to 21-year-olds, we can infer that young people in THP-plus are experiencing similar, or in some cases worse, harms. Next slide, please. In terms of financial security, providers reported that 77% of the respondents served youth who had been laid off, 76% served youth who had work hours severely cut, 50% served youth who have a week or less of money available to them, and 40% served youth who indicated that they're in a financial crisis. Financial security is one area where COVID-19 may be having a more detrimental impact on youth who are in THP-plus compared with younger youth who are in THP non-minor dependent. Even though employment rates and wages are typically higher for youth in THP-plus, their wages are still just above the minimum wage. In addition, THP-plus participants, as Sabrina mentioned earlier, are much more likely to be supporting families on low incomes. In 2019, 40% of female participants who were exiting THP-plus were custodial mothers, and out of the parenting youth who were exiting the program, 30% had more than one child. So in practice, that means that the financial toll of COVID-19 is likely being felt more strongly by THP-plus participants because they're stretching these already thin resources to be able to support their families. Next slide, please. In terms of education, 74% of respondents served youth who had stopped participating in classes at school, either K-12 school or college, and 65% served youth who expressed a need for education support, including a laptop, tutoring, or internet. Next slide, please. 2% of providers served youth who tested positive for COVID-19, and 21% served youth who had been required to be quarantined as a result of possible exposure. Again, these data are from April, so it's likely that this has probably changed and that these numbers may have gone up since then. Next slide, please. We know that many youth in THP-plus are diagnosed with mental health conditions under ordinary circumstances. Survey respondents said that 83% of them served youth who were experiencing depression, anxiety, or another mental health condition. 45% served youth who increased their level of drug or alcohol use during COVID-19. And 48% served youth who had lost contact with supportive adults. Next slide, please. 17% of respondents served youth who experienced domestic violence, and 12% served youth who were experiencing sexual exploitation, I think that these findings really highlight the added risks that former foster youth are facing right now during COVID-19. And we wanted to share them so that it can help to ground the discussion as we think about ways that counties can proactively prevent homelessness for these young people during the pandemic, and to understand what types of added harms they may be facing if they were to have to experience unstable housing. So before we jump into the 6 strategies that we'll be talking about, Carla is going to give us an overview of Santa Clara County's THP-plus program in order to give some context for the information that she's going to share throughout the presentation as we talk through the different strategies. Next slide, please.
Thank you, Britt. Yes, before I talk about THP-plus in Santa Clara County, I just want to highlight some of Santa Clara County's response to COVID-19. So our THP-plus providers here in Santa Clara County are the Bill Wilson Center and First Place for Youth. They have been supporting youth through shelter in place by ensuring that they have the technology to finish school, for example, laptops and hotspots. They're connecting youth to tutoring services via Zoom and encouraging them to reach out to their professors for their office hours, and all that's being done through Zoom. They're helping youth apply for unemployment benefits and or look for other employment opportunities. However, there's increased competition.
and addressing other basic needs on a case-by-case basis with food, rental assistance, and mental health support. Some of our youth are taking shelter-in-place a little more seriously than others. Challenges the youth are experiencing are feeling isolated and anxious with shelter-in-place. Youth who are attending college miss the routine of going to class, having that in-person connection, and worry that they will not do well with the online format. There have been some tensions between roommates, as before they were out and about, working, going to school with friends and family. They may have seen their roommates briefly during the day, but now they have to remain home and they see the roommates all day, every day. These challenges are addressed through one-on-one case management services. In addition, we're posting COVID-19 information on our youth center, the Hub's social media accounts. We're to access food in the community, where parenting youth can receive free diapers and wipes through Santa Clara County First 5, county public health information, and most recently, the location of the county's cooling centers. Our youth center serves current and former foster youth ages 15 to 24. The youth center has been open during shelter-in-place, providing basic necessities such as food, showers, laundry facilities, and use of computers if youth need to connect with family via social media. Staff are taking every precaution to ensure both staff and client safety. Now I will talk about THP-PLUS in Santa Clara County. So as mentioned before, Santa Clara County THP-PLUS providers are the Bill Wilson Center and First Place for Youth. We have a total of 142 slots. On our wait list, we have 244. As seen on this slide, if a youth is on the wait list under 100, it could take about 3 months for a slot. If higher, it can take 6 to 8 months. Foster youth can be placed on the wait list when they turn 18. They can be referred by their social worker, probation officer, CASA, anyone in their circle of support, as well as self-referral. We currently have 129 youth who have aged out and 115 NMDs on our wait list. Next slide. The information on this slide is an age breakdown particular to Santa Clara County youth. The highest number represented on our wait list are NMDs age 20. Youth are referred to an open slot based on the date of their referral. If they were put on the wait list at age 18, there's a good chance that they will be able to transition to an open slot at the time their child welfare case closes at 21. Both Bill Wilson Center and First Place for Youth are also THP NMD providers. At times, we have been able to have a youth transition smoothly from THP NMD into THP-PLUS with the same provider. We have a social services analyst who manages the THP-PLUS waitlist. The analyst works with the providers to forecast openings and prepares youth on what to expect from the program and are ready to meet the program requirements. We also provide other housing resources within the county to youth on the waitlist who are experiencing housing instability, and I will talk about those a little bit later in the webinar. I will now pass it on to Simone to discuss THP-PLUS extension.
Thanks, Carla. And thanks for kind of sharing, giving us really a foundation that you'll build on for later in the webinar and helping us understand kind of the impact of COVID-19 specifically in your county. So we're going to dive into 6 steps counties can take to maximize participation in THP-PLUS and then also to ensure housing stability. So this kind of grew out of, as you probably heard, the governor issued an executive order that, among other things, allowed youth to remain in extended foster care, even if they turned 21 up until June 30th, so that youth weren't exiting care during the state of emergency. And so people started asking, is the same thing going to happen to youth in THP-PLUS? What happens when youth turn the age of majority for THP-PLUS, or, what do we do with our waiting list? Just really recognizing, as others have shared earlier on this webinar, that, housing was an issue before COVID, housing is an issue during COVID. It is a tight housing market in our state. And so kind of how can we best support youth during this state of emergency? And so, we are working on some, things at the state level statutory change that would do something similar for youth in THP Plus for an extended period as far as allowing them to remain. But you know, it is a very tight budget year, so we'll see where all of this lands in a couple of weeks when the state budget's passed. But in the meantime, kind of on the more ground level, you know, organizations start talking about what can counties and providers and other folks do now to really ensure housing stability during this really tough time. And so Youth Law Center, Bay Area Legal Aid, and John Burton Advocates for Youth developed this guide just with the goal of ensuring that youth are not experiencing housing instability or homelessness during the public health or economic crisis, kind of by applying 3 strategies. So the first one being to maintain youth in THP Plus, the second one being to expand housing capacity or housing options really for transition age, former foster and probation youth, and the third, communicating a clear countywide strategy to youth and stakeholders. So this publication is available at the link on the screen, but it's also, again, it's uploaded to the control panel, as I mentioned earlier, along with the presentation. So let me, where's my mouse? There it goes. So we'll dive in now to these 6 steps or these 6 strategies to do all of what I just described. So the first strategy is to expand THP Plus eligibility by extending the age and duration requirements for students. And we've talked about this already a bit. Sabrina shared information about the extension when she talked about THP Plus eligibility, but just kind of a refresher and some additional information. The THP Plus extension was established by legislation that we sponsored in 2014, SB 1252, and that was authored by Assembly Member Norma Torres. The extension allows youth in school, either secondary or post-secondary, including vocational programs, to participate in the program for a longer period of time, ideally to allow for completion of their education. So youth enrolled in school can stay in THP Plus for up to 36 months instead of the 24 months, and or up until age 25 instead of 24, whichever comes sooner, if they're enrolled in school. So this is an opt-in program. Not all counties offer it, but for counties that do, it's an all-in situation. So they must apply the extension to all eligible participants and not on a case-by-case basis. So currently, 28 counties out of the 47 counties that have THP Plus programs have opted into the extension. And you can view a full list of who those counties are on the link, at the link on the right-hand side of the screen. And we update that once a year. We communicate with the state to see if any new counties have opted in, and we update the list. So this was last updated at the end of the last fiscal year, and it'll be updated again this coming July. And counties that would like to opt into the extension, it's fortunately a very simple process. They email the email address on the left-hand side of the screen, and then at the local level, make all the necessary, local plans. So notifying and working with obviously their THP Plus providers to implement the extension, and then also notifying other key stakeholders like juvenile probation and caregivers and youth and those that work ILP, others that work with youth. And then the ACIN on the extension is at the bottom of the screen. So if you want to see the information, kind of the official information the state put out back in 2015 about the extension, it's available there. So for counties that are not fully expending their THP Plus realignment allocations, I think this is a really great strategy. It allows youth to remain in a supported environment for longer. It provides them more time for completing their education because we know that it can take youth longer than just a couple years to complete college or post-secondary education. And it also encourages and incentivizes education, I think. And I think there's also, something to be said about how this is kind of an especially smart strategy right now with the state of emergency. It's, I would say, a more valuable strategy than it is even normally. And I would think that counties might want to consider it even if they are fully expending their THP Plus allocations. Consider, using county funding to allow youth to stay in the program longer. And we know that at least one county is doing this. One county that Britt and Sabrina work with has decided that they're going to opt in for the remainder of the year in response to the crisis. And so this county already expends their full budget and then some. So they, I don't think that they necessarily intend in the long term to keep the extension, it sounds like, but they are going to commit to this year opting in order to keep youth in the program as long as they can to support them during the crisis. So now Santa Clara County is one of those 28 counties that has opted into the extension. And so Carla is going to say a few words just kind of about how the THP Plus extension has really operationalized in Santa Clara.
Thank you, Simone. Next slide. So Santa Clara County offers the THP Plus extension. Of our providers, Bill Wilson Center has 97 of the slots, and First Place for Youth has 45 slots. And the total amount is 244. We understand, it takes foster youth a little bit more time to complete their education, so we're more than happy to add the extension to support our foster youth education. And currently, right now, the Bill Wilson Center has 24 former foster youth in the third-year extension, and First Place for Youth has 9 former foster youth in the third-year extension. This year is our third annual foster youth graduation ceremony. Due to the circumstances, we will be hosting a virtual graduation June 26th. We have identified 8 youth from THP Plus who will be honored at the celebration. We honor our youth who have graduated from high school, obtained an AA degree, bachelor degree, transferring from a 2-year to a 4-year college, and/or earned a vocational certificate. We partner with Santa Clara County's community partners, the Bill Wilson Center, CASA, Pivotal, and the San Francisco 49ers. Now back to Simone on how counties can utilize the new THP Plus enhancement funding.
Thanks, Carla, for that. So we're going to move on to the second strategy here, and that is to supplement THP Plus funding with new money available through the Transitional Housing Program. So this was a budget proposal we sponsored last year that included funding in the fiscal year 2019-20, so this year's state budget. And it's funding intended for THP Plus. The way in which it was included in the state budget was not to literally be added to the current THP Plus budget because that funding has been realigned to counties. But these are new state funds that are provided to counties on top of what they receive for THP Plus. And this THP funding has very similar target population. So the funding is administered by the California Department of Housing and Community Development. So that does differ. Normally we see funds go through Department of Social Services for THP Plus. But it's allocated to county child welfare agencies. So like THP Plus, county child welfare is administering the program or the funding locally. It is an annual $8 million allocation subject to budget appropriation. Like several programs included in the current year's budget, it technically would be suspended in 2021 unless revenues outweigh expenditures. But if they do not, there is bill language that indicates that the legislature would consider alternate solutions to facilitate continued implementation of the program. And so we do look at this, as annual funding, and we certainly would fight for this program should it be subject to any budget cuts, considering as we go into, what's being described as an economic recession. We do, understand that things are being cut. And so we just want to make that clear that we will continue to fight for this program should it be considered for cuts in future years. The eligible youth for this THP funding are actually 18 up to 25. So this is very similar to THP Plus eligibility, which is 18 to 24, unless they've opted into the extension. But it does include that additional year. And with this funding, there's no requirement that youth be in school to access that additional year. So there's a lot more flexibility with this funding to provide kind of an extra year of program to young people that need it. The new funding also is a bit flexible in the eligible population. So and for also the time that you can serve youth. So there's no time limit that youth can be served with this funding. So they don't have that 24-month window or that 36-month window, and eligibility is opened up in the sense that counties must prioritize former foster and probation youth, but there's no hard and fast requirement that youth must have been in out-of-home placement on their 18th birthday, like THP-PLUS and like extended foster care. So this THP funding really gives you an opportunity to serve youth who may have exited care, at 16 or 17 or any time earlier than that, really making them, ineligible for THP-PLUS, but potentially still in need of housing and services. So these are I'll cover this slide kind of quickly. These are the eligible uses for the Transitional Housing Program funds. The funds are intended to help youth age 18 to 25 secure and maintain housing. And then HCD, has listed out 4 examples of what this means. I won't kind of go into great detail, but I'll say that, this program and its intention is quite aligned with THP-PLUS. And so kind of as we have talked with counties that are, receiving these funds, most of them we've talked to really intend to use these to grow or enhance their current THP-PLUS program. So although these funds were included in the current year's budget, they're actually just getting out the door. We've received word that from at least one county that they have funds in hand. They've received the funds, and so that's really good news. There is a 3-year window to spend the funding, so it does not have to be spent by this June 30th, luckily. And county child welfare agencies were required to accept their THP allocations by April 15th. And they are, if there's counties that have not yet received those funds, they should be reaching counties, by the end of this month, by the end of the fiscal year. A total of 48 counties accepted their THP allocations. And it's mainly, there's 47 counties that have THP-PLUS programs. So we see significant overlap with the counties that have THP-PLUS programs. These counties have existing providers they can turn around and amend their contract with, and it doesn't require them to start a whole new program. So that really kind of makes sense as to why those 48 counties accepted the funds. And then the list of who those counties are is at the link on the slide. And that link doesn't only provide a list of counties, but it also provides additional information about THP, about this THP funding, this new funding. So check it out if you want more information, and certainly email me if you have any questions here. So next, Carla is going to talk a little bit about how Santa Clara is going to enhance their THP-PLUS program to better support youth with this new funding.
Thank you, Simone. Next slide. So in preparation for the enhancement funding, Santa Clara County met with our providers, the Wilson Center and First Place for Youth, and we agreed to use this funding to support clients' individuals' needs, especially during these uncertain times. As seen here, examples, food and technology for their education. During COVID-19, our providers have received many donations in regards to technology. In order to ensure sustainability, we want to have additional funds to support the individual needs of our youth. Secondly, we want to increase the rental subsidy. As many other Bay Area cities, the rent is very high in Santa Clara County, as seen on this slide based on the fair market rate. Our THP-PLUS rental subsidy is currently lower than the county's rapid rehousing rate. For example, a single rate for rapid rehousing is as low as $1,000 and $1,500 for the high end. This will provide additional opportunities for housing that previously may have been out of our youth's reach. Next slide. As seen on this slide, Santa Clara County slot allocation is based on if a young person is housed or unhoused. Per the contract, the provider needs to identify housing within the first 30 calendar days. A rental subsidy during this period, while the placement is being arranged, may be used as an initial rental deposit. If the provider is unable to place a youth within 30 days, the county shall deduct the payment of the rental subsidy for every month of non-placement. The provider, however, may use the amount to supplement clients' subsidies, such as food, gas cards, or whatever needs they may have for their, if they are parenting youth, subject to county approval. Now, Britt will talk more about how counties serve out-of-county youth.
Thank you, Carla. So I'm going to move on to our third strategy from the 6 strategies document. This strategy revolves around coordination between counties and discusses out-of-county transfers, or counties that are serving out-of-county youth. So counties have the option of serving youth in THP-Plus that have exited from a different jurisdiction. Right now, at least 37 counties accept out-of-county youth in some capacity, and as you can see on the slide, John Burton's website has a link that lists the counties that have out-of-county youth. However, the counties have the discretion to decide how they want to prioritize and make decisions about accepting youth from other counties. So for counties that are not fully expending their THP-Plus allocations, or counties that have no wait lists for THP-Plus, accepting out-of-county youth is a great way to maximize program participation and to get young people housed faster, and that holds true during COVID-19 as well, when we know that there's a great need for housing among these youth. In terms of regional coordination, we think that regional coordination between THP-Plus programs could help programs facilitate youth who want to move from one county to a different county, whether that's for school or for family reasons, or because of displacement that's related to disruptions in their routines because of COVID-19. I can tell you from personal experience working with clients that when clients want to, when youth, I'm an attorney, when youth want to move from one county to another county, it can be really difficult for them to understand what that process would look like, partially because each county implements THP-Plus in a different way, so the access points and the referral processes may look very different. For example, I work in Alameda County, where the Department of Social Services contracts with one provider, and that's First Place for Youth, and First Place for Youth administers a centralized referral process that refers youth to 4 different providers' THP-Plus programs. So most youth access THP-Plus either through their AB 12 workers or through the independent living programs in the county, or there's also a referral form that they may access through other providers as well. Compared with San Francisco County, in San Francisco, THP-Plus has become part of the Department of Homelessness and Supportive Housing, and it's accessed through the Homeless Coordinated Entry System that's available to all homeless adults and youth. So for young people who are trying to move from county to county, these differences can be really confusing. And if counties increase coordination and even during this crisis, consider loosening their requirements for accepting out-of-county youth and trying to streamline referral processes, that can help youth make these moves happen more efficiently. It can spare young people anxiety, and it may prevent them from becoming homeless because they sort of get lost in between trying to move counties. Next slide, please.
For Santa Clara County, we have a policy to serve out-of-county youth. Eligibility is determined by our social service analyst, and youth placed on the wait list, as I said before, are placed by their referral date. If an out-of-county youth is referred, we will verify with their county of origin if they have used any THP-Plus time in their own county, especially for the youth over 21. We currently have 37 out-of-county youth on our wait list. Next slide. On this slide it's a breakdown of our out-of-county youth. The highest number here is 21-year-olds with 11. As mentioned before, our social service analyst works with the providers to forecast openings and prepares the youth on what to expect from the program and that they're ready to meet the program requirements. There are times that the youth is currently out of county and they're going to be moving into our county. So we try to get the youth connected as soon as possible to the provider, so then they can determine the time of when the youth will move into the county, when the slot is available. And as mentioned before, we provide other housing resources within our county for youth on the wait list who are experiencing housing instability. I will now pass it back to Simone to discuss the Homeless Housing Assistance and Prevention Program.
Carla. So we're moving into our fourth strategy here. So the fourth strategy is to utilize new state funding to establish additional supportive service or additional supportive housing for former foster youth at risk of or experiencing homelessness. So in the fiscal year 2019-20, the current state budget, $650 million was included to address homelessness as the Homeless Housing Assistance and Prevention Program. And we kind of, for short, the acronym there is HAP. So we'll call it HAP today. So HAP provides local jurisdictions with funding to support what are really described as really 8 evidence-based interventions and a 9th that's not quite evidence-based but is eligible. And then the governor also issued an executive order that jurisdictions could spend their HAP funding on COVID-related homelessness uses as well. So I didn't include kind of a whole list of what the eligible uses are, but I can just share, it's rental assistance and rapid rehousing, operating subsidies and reserves, landlord incentives, outreach and coordination, permanent housing, prevention and shelter diversion to permanent housing. The one that's not quite evidence-based but is eligible is the new navigation centers and emergency shelters. So that's not an exhaustive list, but gives you kind of an idea of what the eligible uses are. So where do youth come in here? So at least 8% of HAP funding at the local level is required to be spent on addressing youth homelessness specifically. So if you do the math, that's at least $52 million statewide. So a really, really exciting investment in the current year's budget that we're just wrapping up now. And this followed the inclusion of $500 million in last year's budget as the Homeless Emergency Aid Program, of which 5% was required to be dedicated to addressing youth homelessness. And the Homeless Emergency Aid Program we call HEAP. That's the acronym for that. So we've had HEAP, we now have HAP, and really this has represented kind of the first real state investment in homelessness. So really, really exciting, and particularly first investment in youth homelessness. And so far, it's been a very effective strategy to ensure investment in youth homelessness. We know that when there's not a youth set aside, a requirement for funding to go toward youth specifically, it doesn't really happen. We look at federal HUD funding, it doesn't really happen there. Less than 3% of those beds are for youth. And we've seen with the state's Project Room Key more recently that, less than 2% of those beds in LA County specifically have gone toward youth. So what we've seen in contrast is with HEAP and HAP, they've had these set-asides, and we've actually seen with HEAP that more than double the minimum amount required was spent on youth. So 10.8% versus that 5% minimum last year was spent on youth. So it's really, I'm sharing all this to say that, the last 2 years have included this kind of unprecedented state investment in homelessness and youth homelessness. And this means that new programs and new potential partnerships are budding across the state to serve youth. And so really child welfare professionals and others should become familiar with what is kind of now available in your local communities to youth experiencing homelessness or at risk of homelessness, so that if you work with young people who do end up needing additional support beyond foster care or beyond THP-PLUS, you know where and how to refer them. So it's really getting familiar with your local homeless response system. And kind of for HEAP and HAP, or for HAP actually specifically, the eligible applicants who applied to the state were these local homeless continuums of care. There's 44 of them across the state, and then the 13 largest cities in the state with populations of over 300,000, and then the 58 counties. And then kind of at the local level, you can see here on this slide, this is kind of how the funding flows. So the state allocates the funding to these 3 administrative entities, and then and the funding is allocated based on their homeless point in time count numbers. And then the local administrative entities there, the cities, the counties, and the COCs, administer the funding to service providers, or in some cases may provide services themselves, but usually through contract with nonprofits. So it's really understanding at the local level what these continuums of care, these cities and these counties are doing with these funds. So I encourage all of you to go out and find out kind of how your local community is spending their what is this year at least 8% of the funding they received. And there's always advocate for more than 8% to go toward youth, particularly if you're in an area where the homeless point in time count has indicated that more than 8% of the homeless population is youth. And particularly for those of you who are working with a county agency, you should find out how your county is spending their HAP funds. In some communities, there may be a consideration for how former foster youth homelessness can be addressed if this is kind of presenting itself as a need in your community. So it's really, bridging the kind of child welfare world with the homeless response world. And I encourage you to go to the link on the screen where it says more information on the youth set aside. We have a page on HAP, so that includes not just the county contacts, but also the continuum of care contacts and the large city contacts, allocation amounts by jurisdiction, and that's also up there on the screen. And then it also provides, we have on our website a roster of all of the organizations that are funded by HHAP from last year that currently have contracts and serving youth now, because you want to get acquainted with who those organizations are in your community as well. So I'm now going to pass it over to Sabrina to jump into our next strategy.
So as you've all observed, we started by talking about the THP-PLUS program and strategies for maintaining youth in THP-PLUS and maximizing both THP-PLUS funding and THP-PLUS capacity through the strategies that were discussed earlier, and then have shifted to strategies for building partnerships and accessing new funding streams, or fairly new funding streams, to expand housing stock for young people in general, with an obvious focus on formerly system-involved youth because they experience homelessness disproportionately. So the 5th strategy is along that 2nd category, and it's collaborating with local public housing authorities, or PHAs, to link young people with subsidized housing and supportive services. And these subsidized housing options for youth are federal funding streams, akin to the Section 8 program that you've probably all heard about or become familiar with. Young people can always apply for Section 8 housing and join the Section 8 waitlist, which are notoriously long. But this strategy focuses on 2 former foster youth specific programs that are federal housing programs, one of which is new and one is a little bit older. And public housing authorities can't receive both of these funding streams at the same time, but child welfare agencies can partner with multiple PHAs to maximize subsidized housing opportunities for former foster youth. So I'll walk you through the 2 different programs that are currently available. The first is the Family Unification Program, or FUP, Housing Choice Vouchers. FUP vouchers provide for up to 36 months of subsidized housing and 18 months of supportive services. It's worth noting that you may have heard about FUP vouchers in a different context. FUP vouchers are also available for families whose children are at risk of placement or delayed reunification because of a lack of adequate housing. And the timelines and eligibility requirements are different. So today, I'm just going to be talking about the other population that is eligible for FUP vouchers, transition age youth who have exited or are about to exit foster care and who are homeless or at risk of becoming homelessness. So if you've heard the term before, but in a different context, that may be why. In April 2020, HUD, the U.S. Department of Housing and Urban Development, awarded 12 California public housing authorities 558 new FUP vouchers, totaling $10.36 million. And I'm just going to read out those public housing authority recipients now so that you know whether this applies to your jurisdiction. They were San Francisco, Oakland. Note that public housing authorities can be linked to a city or a county. They don't always track kind of the county structure that some of our public agencies do. So San Francisco, City of Oakland, City of LA, County of LA, Sacramento County, Santa Barbara County, Santa Clara County, San Diego Housing Commission and County, Santa Cruz County, Sonoma County, and Orange County. So again, those are the FUP awardees, and those FUP vouchers can be distributed among both transition age youth who are exiting foster care and families who need FUP vouchers to assist with reunification. The second program is newer. It's the Foster Youth to Independence, or FYI, Tenant Protection Voucher Program. And these vouchers provide for up to 36 months of subsidized housing and 36 months of supportive services. Under both programs, that kind of pairing of subsidized housing and supportive services is arranged in partnership between the Child Welfare Agency and the Public Housing Authority. Both are required to participate in the program. So FYI vouchers are only available to public housing authorities that offer housing choice vouchers but don't already administer the FUP program. There are 50 such public housing authorities, about 50 such public housing authorities in California that meet that criteria. And on a later slide, we'll provide you with the link to kind of locate your local public housing authorities that may be eligible for FYI. FYI vouchers are awarded on a rolling basis. And so we are aware of only a few that have received funding for FYI vouchers so far. And I'll read them out, but feel free to add in the chat if we're missing anything, because this information is being updated fairly rapidly. Ones we know of are the City of Santa Ana Public Housing Authority, Kings County, Alameda County, and Marin County. And so some of these examples kind of illustrate the idea that child welfare agencies can collaborate with multiple public housing authorities to maximize vouchers for youth. And so, for example, if a child welfare agency is partnering with a public housing authority to access FUP vouchers and receives an award of a certain number of FUP vouchers, but still has a need among former foster youth in their community, they can work with another public housing authority in their jurisdiction, whether that be city-based or county-based, that does not currently administer FUP, to also apply for FYI. Next slide, please. In this slide, I'll just break down the eligibility criteria for both of these voucher programs. And the three criteria are that the youth must fall into the age range of 18 up to 24. Second, they must have left foster care or will leave foster care within 90 days. So there's some time built in for transition planning for youth in care, which is terrific. And then the youth must be homeless or at risk of becoming homeless. So I will just drill down on two of those criteria. The first one, the age criterion, 24 is the maximum age that the Child Welfare Agency can certify the youth as FUP or FYI eligible, and that the Public Housing Authority can execute the housing assistance contract. So once a young person goes through those steps and obtains their housing voucher, they don't age out of the FUP or FYI program once they turn 24. Like they would in a program like THP-PLUS, but it's important to be mindful when referring a young person to the Public Housing Authority for a FUP or an FYI voucher, that if they're imminently turning age 24, that the process may have to be expedited. And then as to the third criterion, homeless or at risk of becoming homeless, we know, or many of us know, that the Housing and Urban Development Department's definition of homelessness is pretty narrow compared to other definitions of homelessness. But that at risk of becoming homelessness provides a little bit more of a safety valve, or provides some flexibility. at risk of becoming homeless includes a person who is exiting a publicly funded institution or system of care, like mental health or health care, or a foster care placement or their youth facility. There are also income requirements, even once these three criteria are met, and those income requirements are assessed by the Public Housing Authority once the youth has been referred by the Child Welfare Agency for FUP or FYI. Next slide, please. The FUP and FYI, as federal programs that are administered locally among an array of different agencies, can be pretty complicated. So this slide just focuses on the immediate next steps that a jurisdiction can take to go about accessing FUP and FYI, or maximizing their array of FUP and FYI vouchers for their former foster youth population. So the first step is to find out who your local public housing authorities are and whether they currently administer FUP or FYI or neither. There's a link here to find your local PHAs based on location, and then a list of the public housing authorities who are administering FUP, which is a more comprehensive list than the one that I read, but the one that I read should contain all of the California public housing authorities that administer FUP. And then there's a link to a list of PHAs that don't receive FUP and are eligible for FYI, and that might be an excellent potential contact to reach out to and apply for FYI jointly. If you work with a public housing authority that administers FUP vouchers, assess how many of those FUP vouchers are available to youth compared to families. There are some jurisdictions that use FUP vouchers almost exclusively for family, and others where it's kind of divided down the middle. And it's important to know how many FUP vouchers are generally available for transition age youth in your jurisdiction. And then if you work with a PHA that is eligible to receive FYI funds, there's tons of guidance on the HUD website on how to apply if the program that the current administration is very proud of and has worked to implement, and I think wants to see more applications. And so definitely access all of the resources that are available by the federal government to access these vouchers. Now I'm going to pass it off to Carla to share what these programs look like in Santa Clara County. Next slide.
Thank you, Sabrina. So here in Santa Clara County, we established the Continuum of Care in 2012. This includes the Department of Family and Children's Services in the Social Services Agency, the Office of Supportive Housing in the County Exec's Office, and the Office the Santa Clara County Housing Authority. The Office of Supportive Housing is the lead agency in the COC. Prior to COC, Santa Clara County managed the FUP program since 2010. Santa Clara County was awarded 100 vouchers available to families with open court family maintenance and family reunification cases. Santa Clara also made these vouchers available to parenting youth in THP-PLUS with an open child welfare case. The 100 vouchers were repurposed, for example, if a family was not able to comply with regulations associated with the voucher, or if the family no longer needed the voucher, the open voucher would be available for a new family. Families participate in a multiple disciplinary team meeting, MDT, along with the referring party to receive a voucher. In December 2019, COC entered into an MOU with all the parties in the COC to support the application for the 2019 Family Unification Program and Tenant Protection Vouchers. The goals of the 2019 Family Unification Program include helping families who are involved with the child welfare system to find affordable and decent housing in a safe and supportive environment, ensure that children who remain with or have reunited with their families are safe and secure and not subject to neglect as a result of homelessness or inadequate housing, empower families to resolve their own problems, to effectively utilize service systems, and to advocate for their children with schools, public and private agencies, and other community institutions. And lastly, assist transition age youth ages 18 to 24 who left foster care at age 16 or older, or will leave foster care within 90 days and are homeless or at risk of homelessness, with housing assistance and supportive services to increase housing stability. September 1st, 2020, Santa Clara will be awarded an additional 48 vouchers. These vouchers will continue to be made available to child welfare families and former foster parenting youth ages 18 to 24 with an open family court maintenance and family reunification case. The Office of Supportive Housing will be applying for 24 tenant protection vouchers made available through the Foster Youth Independence Initiative, which will be available to youth who are in foster care at age 16 or 17 and their dependency case closed prior to 18, but now find themselves in need of permanent supportive housing. The main role of DFCS in the COC is to identify foster youth eligible for the vouchers through an HMIS and CWS CMS data match. I will now pass it off to Britt to discuss communication with young people we serve.
Next slide, please. Thanks so much, Carla. So I'm going to talk about our sixth and final strategy that we discussed in the 6 Immediate Steps resource. We named it Alleviating Participants' Anxiety by Clearly Communicating County and Program Plans to Preserve Housing and Services. So as you can tell, the thrust of our entire resource to counties was sort of by way of encouraging counties to take these suggestions or recommendations into account and then be able to make decisions about what's going to make the most sense for their county as a response to the crisis that's going on. We recognize that there are going to be significant county-to-county differences, but wanted to give some suggestions for how counties might make a plan. But our hope is that counties will be able to formulate a clear and coherent plan about how they're going to respond to the increased risk of homelessness among THP-PLUS youth during the crisis. And then this strategy 6, is really about what happens once that plan comes into place. And we want to encourage counties to communicate with young people, communicate with providers, and communicate with community-based organizations and other types of non-housing providers that also work with young people to help provide young people with the information that they need to be able to feel safe and make good decisions. So this strategy, I will say, is emerging out of advocates' observation that young people are having a really hard time sometimes accessing the information that they need. I think it's usually the case that young people may have to go out to a number of different providers to seek information about what resources might be available to them. And because of COVID-19, the difficulty of accessing information has skyrocketed. Young people may be leaving their homes, which is really not safe for them and not safe for the community, to try to go door to door to different organizations to see who can help them try to engage in transition planning and help them alleviate their anxiety about becoming homeless when they age out of their programs. And so we're really trying to encourage counties to come up with a strategy for communicating with youth to prevent youth from having to go out and kind of knock on doors to gather information. So in doing that, there are a number of factors that I think counties would want to take into account. The first thing is not on this slide, but in terms of planning, figuring out how many youth are impacted by the problem that we're describing today. How many young people are slated to age out or time out of THP-PLUS during what we think may be the time period when we have this public health crisis and economic crisis going on. So really looking at the numbers and using the numbers and the identities of the individual youth as a guide for how the communication strategy gets built. And then a second thing would be advanced planning. You can see on the slide, we talk about targeted communication for youth approaching exit. I think that Carla gave a great example earlier of how counties can do advanced planning when she talked about having a technician who is specifically dedicated to ensuring that young people who are turning 18 and may be eligible for THP-Plus in the future are getting onto wait lists far in advance because Santa Clara County understands that it has long wait lists for housing. I think that there are ways that counties can incorporate that kind of proactive planning by looking at, the numbers, how many young people are going to age out, and really getting in contact with those young people now to start making plans so that they're not in a reactive position down the line. Another recommendation would be for counties to sort of step in and potentially provide technical assistance or additional training and information to providers so that providers can fulfill their duty to help young people with their case planning and transition planning. So Sabrina mentioned this earlier, but under the state certification laws that apply to THP-Plus, providers have an affirmative duty as part of their certification to engage in case planning with THP-Plus participants, and that really is, helping participants create those TILPs, and then specifying in the TILPs what concrete steps the providers are going to take to help the young people meet the goals that are in their TILP. And one of the goals that's listed as needing to be addressed in a TILP is how the young people are going to acquire safe and affordable housing. So it's really, the providers are in a position where they have an affirmative duty to be taking concrete steps to help young people acquire safe and affordable housing. But what we've seen is that because the information about available housing resources is constantly changing, providers may not have the resources that they need to be able to do the best possible transition planning that they can with young people who are aging out of THP-Plus. So that's where it could be beneficial for counties to step in and making sure that they're collecting and communicating that information to providers and giving some oversight to make sure that providers are following through on that duty to be doing transition planning with young people. Counties can also centralize information. They can use social media so that youth will be able to access information about what their housing options and other resources are in the county, and potentially out of county as well, going back to the regional coordination strategy that we talked about earlier. Counties can engage community-based organizations that serve young people to help disseminate that information to youth. And then finally, counties can ensure that providers are giving the proper written notices to young people as they're approaching exit. I know that on the ground, there are often sort of informal communications around when young people are going to age out or time out of THP-Plus, and that may not always give young people enough notice and understanding to be able to engage in the planning that they need to do. So we want to encourage written notices. So this is just an overview of different strategies, but the goal is to engage in this clear communication and all of this advanced planning with counties and partnerships with the providers to ensure that no young person will leave THP-Plus without a transition plan, because we don't want to see young people exiting into homelessness. So that concludes the strategies that we outlined in the guide that we've released. However, Carla is going to share a couple of additional creative strategies that Santa Clara County is utilizing to give young people resources. So I'm going to turn it over to Carla. Next slide, please.
Thank you. So in the next two slides, I will speak to other housing resources we have here in Santa Clara County. We are currently piloting the Universal Basic Income, UBI, for former foster youth whose dependency case was in Santa Clara County. We have 72 vouchers for Santa Clara County youth. They have to be 25 years of age and determined federally eligible, a current resident of Santa Clara County, and they will receive $1,000 per month for 1 year. Youth will receive mentorship and case management provided by an identified contractor. This will launch this month. We have already identified former foster youth for this pilot, and a provider will be announced shortly. Next slide. In Santa Clara County, we also encourage foster youth to complete the VI SPDAT assessment to get them on the county queue for housing. We are very fortunate that Bill Wilson Center, who is also the contractor for our independent living program, and the Hub Youth Center have staff trained to conduct these assessments. We think this is really important because it allows our youth to complete the assessment with someone they're familiar with. And in addition, the Bill Wilson Center is on the list of housing providers within the county queue for TAY. I will now pass it back to Simone.
Excuse me. Thank you, Carla, and thank you all of the presenters. Really, I just have to say this publicly. I think everyone knows on webinars that there's always a time crunch. You want to get through the content quickly, but you want to provide enough time to make it, able to be understood and the important points out there. And so thanks everyone for kind of getting through. And we have a full 15 minutes for Q&A. We've got a lot of really great questions submitted. So I want to go into Q&A now, and you can continue to submit questions, and I'll turn back to the questions box as I get through the ones that have already been submitted. So the first question is, how can we gain access to the current wait list for THP-PLUS? So I will say, there is no kind of statewide wait list. We have wait list data because we gather it. The John Burton Advocates for Youth, we put out an annual report on THP-PLUS and THP-NMD each year. And we gather information about the numbers of youth on wait lists across the state. But there is no kind of statewide wait list. So it would be a county level action you'd be taking. So, in some counties, the wait list is actually managed by the county. That's less common, I think, but it is the case in some counties. And then in most counties, individual providers kind of manage their own waiting list. So if you are in a county where the county manages the wait list, you'd want to contact your child welfare agency, the THP-PLUS kind of county contact. And if you go to our website, there's a rosters page, and we have a roster of THP-PLUS county contacts that you can access. And if it's managed by the provider, you'd want to contact that individual provider. So the next question is for step 2. So that had to do with the transitional housing program, the new funds. We've received a notification from HCD that they will not be giving us one of the allocations, the Housing Navigator program. What are some ways we can advocate to get this back? So just to provide some framing, so alongside the THP funding, another program was funded in this year's state budget. It was housing navigation. So there was a one-time allocation of $5 million, and it's totally separate from THP, but they both got put in this year's budget. And so this person's asking about this housing navigation funding. So as probably all of you know, we are in a budget deficit at the state level. State general fund, it's like a $54 billion deficit. And so the governor is looking for ways that he can try to fill that hole, doing the least harm possible. And so some of the things he was looking at was programs that have not yet been implemented. Can he pull funding back from some of those programs? Now, unfortunately, housing navigation was on that list. And so in his May revision of the budget, he has proposed to pull back that $5 million that remains unallocated from the current year's budget to fill next year's budget hole. Now, the legislature does not necessarily agree with that decision. And so, and they are developing their own budget. And from what I understand, those funds have not been pulled in that budget. And so we'll see how this all shakes out. If the person asks, what are some ways to advocate, contact the governor, contact your members of the legislature, and advocate if that's something that is important in your county. So the next question is for Carla. Carla, have you found that youth, so this is in regards, I think, to the very last slide that you presented on, Carla. Have you found that youth qualify for services through the continuum of care? So kind of when you have youth complete that via SPDAT, are they qualifying for services after they leave THP-PLUS? And then a follow-up question is, what does your relationship with the continuum of care look like? Do you have a formal MOU, or is this more of an informal relationship?
Yes, so we established an MOU in 2019 with the Continuum of Care. And in regards to the VI SPDAT, yes, if a youth is at risk of homelessness, because like a lot of other counties, as I stated earlier, it's very expensive to live here. And with our youth, you know, lives can change from one day to the next. And so, you know, our staff at the hub are trained on how to complete the VI SPDAT. They, you know, most of them have good relationships with youth who come in and out. And historically, our youth may not answer the questions truthfully, but I think it's really helpful that they have someone who, like I said, familiar with, where they can get the youth to answer the questions honestly, because I think that's been sort of an issue. The youth have been truthful on the questionnaires, and a lot of our youth don't like filling out questionnaires in the first place, but we have seen youth qualify, and they have received housing through the assessment and through the continuum of care.
Thanks, Carla. That's really helpful. So someone has just made a comment, you know, universal basic income with an exclamation point. I would love to hear more about that process and how difficult or easy it was to have the county kind of make the decision to do that. Carla, are you comfortable with anyone contacting you? Because I know that this is something that a lot of people are excited to hear more about.
Yes, if they can send me an email, then I can put them in connection with the appropriate staff to go into more detail of how this was established and created within Santa Clara County. I know our Board of Supervisors was really pushing for this, so it was a process, so we can provide more information to them.
Great, thanks. So, and I am getting questions. Will the presentation and handouts that will be sent to us, will they have the list? Will they have the list of the housing programs in other counties? I'm not sure exactly if this person wants to just clarify what they are asking, and we will make sure to include that information in the follow-up email. Another question that came up is about SUP vouchers. So, and I've heard this definitely before. You know, it says we have a lot of SUP vouchers. That's great, but we have difficulty locating funding for case management services. HUD only provides funding for the vouchers, but not for the case management. So, you know, which is a requirement for the SUP vouchers. So I think one question would be, Carla, where does your funding come from? And then maybe Britt and Sabrina, for the counties that you work with, do you know what funding counties are using for that, those services? And also, Carla, if you just want to share, I know you shared this, I think, previously, but just kind of clarify how the Housing Authority offers the voucher, you all offer the supportive services, and then your contract with the BODE. Like, if you can just kind of describe that structure, maybe it would also be helpful.
Yes. So, like you said, we have, you know, the Housing Authority has the voucher. We have actually a staff, a social services analyst that provides some light case management. And then also through a BODE, they receive, you know, more intensive services through a BODE. You know, that's the contractor through the continuum of care that we have. So that's how our families and the youth that are referred are able to, you know, maintain in the program, you know, the supportive services, you know, regarding just other resources out in the community.
Thanks. And then, I mean, I don't know, Sabrina, I know you presented some stuff, and I'm sure you have more information. Do you have an idea kind of any of the counties that you work with, what funding they use for the supportive services?
I will say descriptively more than prescriptively that the counties that I have spoken with, and this is something that I'm looking into kind of ongoing and don't have a complete picture of, but often counties will engage kind of community-based organizations that are well equipped to provide community-based services or supportive services to a young person kind of based on what their needs are, whether it's mental health or somebody who has experienced violence and has coordinated supportive services with that agency rather than with a designated staff or coordinated partner. But that doesn't mean that the model that Carla just described doesn't exist elsewhere. It's just another model that I have observed in other counties.
Thanks. So the next question is about HAP funding. So it says, can a big city receive monies within a county that also received homeless funding from the state? And then the follow-up question, is the big city autonomous from the county in their spending? So yes, so 13 cities received a HAP allocation, and it is not contingent. It's, the counties that those cities are located in also received HAP allocations. So it's not an either or situation. So I'll just give an example to be really clear. City of Oakland received HAP funding, and so did Alameda County. Or City of LA received HAP funding, and so did LA County. So it is definitely not an either or situation. It's just based on, for the city population size, over 300,000 population, those cities got specific funding. And then the continuums of care, throw a third party in here. So we have 3 different entities receiving funding. They're regional, so they often actually cover multiple counties. Sometimes they're just aligned with one county, and they definitely cover, more than one city. So there's 3 different doors that people can go through to try to kind of understand how the funding is being used. And the question of whether the big city is autonomous from the county in their spending, they are autonomous. So they do not have to, there's no requirement that these funds are kind of co-administered or that they are spent together. So cities may have their own priorities that they've gathered from their community as far as how to spend the HAP funds, and then counties may have their own priorities, and the continuums of care may have their own priorities. But there is a requirement that these entities all do a stakeholder input process so that they aren't just making these decisions by themselves, they're doing it with community input. And I will say that I've heard so far several counties and continuums of care are collaborating to administer their funding. So I have seen that partnership happen, not so much with the cities, but with the counties and the COCs. Another question about FUP. So this one is regarding FUP and FYI eligibility requirements. Is there any work in eliminating the requirements for youth to leave foster care within 90 days? Our department in Orange County would like to advocate for that requirement to be optional. So this is, FUP and FYI are both federal programs, so that would require a change in federal law. I am not aware of any current efforts to do that. Britt or Sabrina or Carla, are any of you aware of any efforts to eliminate that requirement?
I'm not aware of any efforts either. I know that I think it's called Action Ohio has been kind of the driving force between a lot of the FYI advocacy and the coalition that led to the creation of FYI. I don't know if they're planning on any additional advocacy or on this issue, but I think they would be the first point of contact to think about how to organize a push around that issue. And I do recognize how difficult it has been across housing programs to have these requirements that young people exit from care before they can access a program. I know that it's not just exclusive to FUP and FYI, but also to some state administered programs. And so that is something that we are looking into and thinking about creative solutions to. So any ideas you have or stories from your county, feel free to reach out so that we can assess the needs.
Thank you. So I got clarification from the person that was asking about whether we're going to send out a list of programs. So what this person is referring to is the list of THP-PLUS programs. So we can absolutely do that. They said I'm a social worker, and a lot of their NMDs want to move to other counties. And so this person wants to just have a list of the programs statewide, the THP-PLUS programs. So we have that. I think what I'll do is I'll send with the follow-up email a link to what we call the THP-PLUS provider roster, and that's listed by county. And then I'll also provide a link to the county roster, which is just for the county contacts. But I'll also provide a link just to our overall rosters webpage, which we made recently. We realized we manage so many rosters, we should probably just have a roster webpage. So you can, go to that webpage and find everything there. But I'll call out the THP Plus provider roster in that email to make sure you all have that. So we are at 11:30. I know we didn't quite get to all of the questions. But I can, if you'd like your question answered and it wasn't answered, feel free to contact either myself, or if you know who your question is for, to contact that person directly. Certainly, if you have questions about universal basic income, Carla's information is up on the screen, and she has agreed, and I don't know if it was because I put her on the spot on the webinar, but she has agreed to receive questions about UBI and route them accordingly within her county. So that concludes our webinar, and I wish everyone the best in these kind of very strange times that we're in, and I hope that everyone is safe and healthy. Thanks. Bye-bye.